super low income populations. What I learned in DC, and now that I'm at NC State and I'm working more at the state and local level, is how important public policy actually impacts the work we do. So, really, today we are going to be focusing on updates on the federal farm bill that just passed, some new legislation that will be maybe coming forward, and also, again, how is that going to link to your job? What is the background behind it? So, first off, I do want to talk to you just a brief overview of today's morning session. One, again, what is the intersection between nutrition and policy, as well as the Farm Bill? I know you probably most of you know about SNAP, but there is some urgent areas around SNAP right now, and we'll discuss that a little bit, as well as what happened with SNAP and the 2018 Farm Bill and the Child Nutrition Reauthorization Act. And you see that there was 2010, 2015, and question mark, meaning we're still waiting to see what's going to happen this year or possibly next year. And then I do want to talk about, what are some current policy threats to these programs that we all love and, well, not all love, but I will say we usually support because it's usually targeting and working with the individuals that we are wanting to work with. And I think the first and most important point is, what do policymakers actually do? That's a question I get often. And I think there is a lot of communication around, well, what do they do? What I think they do? What do they really do? But basically, policymakers are either elected or appointed individuals at some level of government. So this can be local, it can be state, it can be federal. They can also be executive assistants, staffers, and I know Lauren will be talking a little bit about this later. They also are elected to sell, argue, and advocate for positions. So one thing that's important here, and if you do talk to and want to educate your policymakers, you should always be aware of when they were elected and when they are actually going to be up for re-election or if they're going to retire. Oftentimes, their interests are focused on their re-election cycles. So if they have a short term and a short time and they really are worried about getting reelected, if you're going to bring something new or radical or something that's not been done before, recognize that they may not have the bandwidth or the power to push that through the legislation. So just always be aware of when someone was elected and when they're either going to retire or if they're going to be reelected or if they're going to go for a higher position as well. They also make decisions that are often the result of compromises. We all have to compromise. So they do have to talk with each other and they do have to sit and discuss for hours at length on what the final bill or what the final decision is going to be. So oftentimes there's an issue with us communicating with policymakers, and this is from Ross Brownson at the University of Washington at St. Louis. So here we have a fisherman and people in a hot air balloon. So essentially, the people in the hot air balloon ask the fisherman, well, where am I? And the fisherman says, well, you're 30 meters above the ground and you're in a balloon. And the people in the balloon say, well, you must be a researcher. And the fisherman says, yes, how did you know? And the people in the balloon said, because you told me exactly what we already know, but it's completely useless. And so the fisherman says, you must be a policymaker. And they said, yes, how did you know? And the fisherman says, because you don't know where you are, you don't know where you're going, and now you're blaming me. So, in our world as experts, we have a lot of facts and figures and information, but the way we convey it, and I think framing was mentioned earlier, is a very important point. So, when you're talking with policymakers, you're thinking about doing policy, understand we have different communication styles and tactics. So, what are policies? So, I heard the term earlier, someone used advocacy as a big A or a little a. So in policy, that can also be the same thing. It is really laws, regulations, or it can be ordinances that are essentially adopted or also adopted formally or on a collective basis to guide individual and collective behaviors. Big policies, you think of federal policies. You also think of small policies, local ordinances, and there's also informal policies. And I always joke that collective behavior. So as we are standing in line to go, watch a movie or something, it's usually common for us to stand in our place and not cut the line. Is that a law to cut the line? No, but if you did just jump in front of everybody, they probably might not be very happy. So think of informal policies and then formal policies. Now, here's another thing. What do policymakers actually want from researchers or experts? Sounds like there are a lot of nutrition experts in the room, as well as we've got students. It seems like we have students that are ranging in masters to PhD programs, as well as state public health officials and people at the health departments. So there's usually three questions that policymakers want to know. One, is there a problem? And your answer is probably going to be yes, because you're not going to be talking with them unless there was a problem. If there is a problem, why is there a problem? And two, do we know how to fix it? Is there an intervention? Do you have a solution? And the last thing is, how much will it cost me? And this is not just a numbers game, this is a political cost. Will this lose me my reelection? Will I lose in my fight against, my component that is now running against me? And I often say that if you do not have an answer to a problem or a proposed set of solutions to a problem, do not talk with a policymaker. They hear complaints all the time. They know what's wrong. We need to give them solutions. So if you have ideas for solutions, or if you've seen other states do great things, I often say, use that as model examples. Again, don't just complain. Give them options. Let them know information. And you have that information because you're nutrition experts. So some of the challenges for nutrition experts and researchers is there are a lot. I've only highlighted a few, but one, poor timing. So a lot of us do research and we work with individuals, and we know that research takes a long time. It takes a long time to recruit individuals. It takes a long time for the intervention to happen, and it takes a long time for us to analyze the findings. So when policies are coming up and policymakers need data, and we're still sitting here in phase one of our project, we can't jump on the opportunity because we don't have the data to inform them. So poor timing is a problem. The other thing I learned in DC is ambiguous findings. Who has ever written a paper that has a limitations section? Raise your hand. Limitations. Okay, so ambiguous findings. Communication teams hate this. Policymakers don't like ambiguous findings because you'll have to say, well, it worked for this population in this age group in this state, and we can only say to a certainty that it worked in those areas. That is very hard for people to sell. They want very basic top messages. And again, framing is everything. So ambiguous findings are difficult. Also, balancing objectivity and advocacy. When I left academia, there were some individuals that said, you will never be able to come to academia again. You're leaving to work for an advocacy organization, therefore you are biased. And I think we all have to realize that we went into this profession obviously because we were interested in it. I'm assuming that since most of you are in the nutrition world, you might care about nutrition or breastfeeding. If you didn't, you wouldn't be in this position. So again, making sure that you can still be knowledgeable about your area, but also be willing to show and tell the things that we don't know about subject matter expertise. Lack of relevant data. There's a lot of research questions I have. One that I'm getting a lot right now is, why are WIC rates declining? Why are people not enrolling in WIC? What is the problem here? And we have hypotheses, but we don't have the data yet. And so I think that's another huge issue, is the fact that data doesn't always have, we don't have an answer to it. There are research questions, we don't have answers. Also, in research in the area, we are always told that a randomized controlled trial is the best thing you can do to have a wonderful study and have great results. Well, guess what? In the real world, doing randomized controlled trials and trying to do them quickly, that's not going to work with policy because it's in a controlled environment and we're able to control the study. So there's this mismatch of randomized thinking and then non-random problems. So I just wanted to give you a basic overview of, again, why I think for a long time researchers, experts, and professionals have had a problem communicating with their policymakers. So I'm going to switch a little bit over to the Farm Bill. So I know the Farm Bill, it just passed. It is it's the largest agricultural law that governs our country. It covers a lot of areas. And it is reauthorized every 5 years. When I say reauthorized, I mean that Congress approves it and it turns it from a bill into a law. It's also administered by the U.S. Department of Agriculture. And it includes a lot of different topics: food assistance programs, farm subsidies, bioenergy, foreign food aid, extension research and support. And I will say, most of the times when I give talks about the Farm Bill, people think that the Farm Bill is mostly going to farmers. Who of you think that that is correct? Raise your hand if you think that the majority of the Farm Bill goes to farmers. Okay, we'll say one. Okay, I will come back to that answer soon. But I do want to talk a little bit about the reauthorization process. And this is the most basic way I could put this in a graph. So essentially, we start with Farm Bill hearings. So usually a year or two before the Farm Bill is going to be passed, you have different legislators going around to different states, mostly farm states. You usually see a lot of Midwest states, and they start having hearings. So I would be a legislator and I would be in this room and I would, invite whoever wants to come to my session. What are you concerned about? If you're a farmer, what are you concerned about? If you're a dietitian, what are you concerned about? And we listen and they hear what are the issues, what are some problems that may be coming up. And then once they feel like they have enough information, they go forward into two separate agricultural committees. So these ag committees, and I know for the using the back, you can't probably see that very well, is you have your House Agriculture Committee and your Senate Agricultural Committee. And essentially they draft their bill and they sit and they discuss, and of course you never know how long this is going to take. But if they draft a bill, they finalize it, they actually go up to what is called a floor vote. So a floor vote is everybody in the House or everybody in the Senate gets to vote on the bill. So if it actually passes through the House or the Senate, and they both pass, it goes to a conference committee. Now, a conference committee is actually a group of individuals from both the Senate and the House. So now we have two of the houses represented, and they want to try to merge the two separate bills that have been drafted. If the conference committee approves that bill, then they send it to the House and the Senate. They both can vote on that. And if it's voted on, they can either vote on it with amendments or they can vote on it without amendments. For some of you in interesting states, amendments can be very interesting because they can be added on last minute that nobody's ever heard of, nobody agreed to, and so amendments are tricky. So that's something that people should always be aware of. Our policymakers, is there an amendment that they want to slide in and they want to get into legislation? Now, if everybody agrees on these amendments, it gets sent up to the president. He can veto it, and then it gets sent back, or he can either approve it. And I will say this entire thing is a game of chutes and ladders. This can break down at any step. It can go all the way back to the beginning. This was every single policy that goes through. This is your state legislator, and this is also the federal government. This can break down, and then you have to go back to the start. Again, simplest way I can put that. But as I asked earlier, what is the majority of Farm Bill spending? So 80% of the Farm Bill goes to nutrition programs. They do not go to farmers. They do not go to foreign food aid. They do not go to research. And this has been consistent throughout the Farm Bill and since it passed. And I will say the Farm Bill came out of the 1930s. We were going under the Great Depression. We had the Dust Bowl. So some of you, if you are from or have lived in the Midwest, essentially a lot of the farmers didn't have great farming practices. And so essentially there was a drought. They didn't have soil, they didn't have crops, and a lot of those farmers actually migrated over to the West Coast. But yes, the Farm Bill was essentially a way to support farmers who were really hurting and also to help get us out of the Great Depression. And I will talk about some of the programs in the Farm Bill that was just passed in 2018 in December. So some of them, these are not, it's not an expansive list, but we have SNAP. And I'll talk mostly about that. We have SNAP Education, so the education arm of the SNAP program. We have the Expanded Food and Nutrition Education Program, as well as the Food Distribution Program on Indian Reservations, and the Senior Farmers Market Nutrition Program, as well as the Food Insecurity Nutrition Incentive Program, so the Double Up Bucks grant program. And this past year in the Farm Bill, they also changed the Healthy Food Financing Initiative, which came out of Philadelphia. That is now actually a grant under the USDA. So that was switched under to a more statewide grant to a federal level grant. And I'm sure most of you know what SNAP is. And I will say that for those of you who don't, I'll briefly go over this, but SNAP is a program that was originally created to alleviate food insecurity. We've definitely shifted its purpose as a secondary purpose over the years to really address increasing healthy food and diet quality, because we realize that SNAP recipients are facing a lot of issues, and food quality is not always their top concern. And SNAP right now, we have about 38 million individuals on the program nationwide. It's the largest federal food assistance program, and it also offers benefits that are used as cash so people can buy certain items. And I think you probably know that. Most states have SNAP benefits distributed at the beginning of the month. I believe California has at the middle of the month, but correct me, Californians, if that is correct. Okay, I'm pretty sure California distributes them towards the middle of the month. But a quick, brief history of SNAP. This actually didn't come around until the 1960s. So it was piloted under JFK after his assassination. It was signed into law by Lyndon Johnson. It's also important that in 1974 it was expanded to all states. At first, it was a optional. You don't have to do this, but if you want to, we will cost share this program. And then 1977, President Carter said, because we were having different states operate the program differently, they said, no, 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 we're basically going to have this program operate the same way across all 50 states. And the other thing I like to mention is that policy takes a long time. So the SNAP EBT, so the Electronic Benefits Transfer Card, the first time it was actually used was in 1984. So Pennsylvania created this in 1984, but it wasn't until 20 years later that they actually adopted it nationwide. So it took 20 years to go from paper-based food stamps to essentially a credit card. And I'm currently in a state that is still paper-based WIC. I know some states have electronic WIC, and we've been promised that WIC is going to be electronicized for a long time now. But again, we might be waiting 20 years. So policy takes time. And in 2008, the SNAP program, it was originally the food stamp program, was renamed. This is really to help alleviate the stigma associated with, oh, you get food stamps. Oh, you're a food stamp recipient. Now, currently, I will say, and when I give talks to individuals that are more fiscal conservatives and want to make sure that we are using our government funding wisely, I say that SNAP is one of the most efficient safety net programs we have out there. 93% of the SNAP budget actually goes to the recipients. It has very low administrative costs, so that other 7%, that's just the administrative costs. So literally 93% of that budget goes to SNAP recipients. Low overhead costs is very efficient, and low administrative costs really helps the program. And most times people will sometimes then ask me, well, if there's low administrative cost, does that mean we have a lot of fraud in the program? No, we don't. The fraud rate is estimated between 2 and 4%. It's the lowest fraud rate, again, amongst any safety net program in the state. The other important issue of SNAP that most people don't know is if a retailer gets caught for fraud, they're out of the program. It's one strike, you're out. You don't get to be in the program again. So with Medicaid, Medicare, essentially, if you have a fraud claim, you just pay the government back. But SNAP, again, one strike, you're out. It's a very serious consequence. So I think that's one of the reasons why they have a very low fraud rate. They have no tolerance, zero tolerance policy. So if people ask you questions about fraud, if they're worried about the fact that there's only 7% going to oversight, that is the reason why. Now, I think you all probably know that SNAP is based on essentially your household income, so the number of individuals that live in your house, as well as how much money you make per month. And each state also has the flexibility to adapt this a little bit. So because you also have to pass an asset test. In North Carolina, you can only have one car. If I have more than one car, that counts as an asset. California, I believe, has a 2-car law limit. So I'm allowed to have 2 cars. But I would fact check that if anybody wants to fact check me. The other interesting thing is SNAP also says you cannot have more than $2,250 in your bank account if you are if you are not a senior. So some people say, well, what if they're just hiding a bunch of money in their bank account? Well, they do have to show records. They look through bank accounts. If you're a senior, you're allowed to have you're allowed to have $3,250 in your bank account. But when you think about that, that's pretty scary if all I have in my bank account is $2,000 or $3,000. We all know that if you get into a car accident, you have a medical emergency, you can automatically need to use that $2,000 or $3,000 very quickly. Another thing is a lot of times people will say, well, people on SNAP get a whole lot of money. Well, they really, really don't. So, an average individual, one person, gets about $125 per month. A family, so two adults, two kids, an average of $250 a month. And also, I think you've probably heard the statistic that individuals on SNAP usually get about $1.40 per meal per day. So think about what you can buy for $1.40. I don't think I can buy coffee for $1.40. So my breakfast I couldn't afford just with my SNAP benefits if I needed to buy breakfast. And also, most households in SNAP they have children, so we're not talking about just individuals. The majority of SNAP recipients are living in households. So, what do we know about the benefits? There are a lot of great things about this program. One, it's very effective at enrolling eligible individuals. So, 80% of people that are eligible are enrolled. It also shows that it reduces food insecurity by up to 30%. That's a huge increase. It's also interesting that there's studies been done that show that diet quality actually decreases towards the end of the month when people's SNAP benefits are being spent down. So we know that diet quality is better when they just get their benefits, and it decreases towards when they're running out. Also, we know that SNAP improves child and adult mental and health outcomes. Numerous studies have shown this, and we also in California, and I cite this study every single time. Researchers followed SNAP recipients and found that those with diabetes at the end of the month when their benefits were running out, they had almost a 30% higher hospitalization rate because they had uncontrolled diabetes related issues. I don't have to explain what uncontrolled diabetes issues are to this group, so that helps me out. But again, SNAP is very important to health and mental health. It also helps people lift out of poverty. We have a huge poverty problem in this country. And in 2015, it was estimated that SNAP lifted almost 5 million people out of poverty. So, some of the challenges with SNAP are one, studies have shown, and they've been mixed, whether or not SNAP recipients' diet quality is better or is it not as good. So, what we show is that SNAP recipients don't always have better diet quality. So, what does this mean if we don't have good diet quality? So, many families still report that there are significant financial barriers to purchasing food with the SNAP program. They say there's not enough benefits. And I also conducted a study with an economist, and we showed that SNAP really, if they were going to follow the dietary guidelines, it really only covers about 43 to 60% of what the government is telling us to eat. So that's probably why we're taking into account the fact that they might not have better diet quality. They can't afford to eat a healthy diet, and even if it is supplemental. So I will say there's one category of individuals in the SNAP program that most people don't focus on. So in the 1990s, under welfare reform, and this was President Clinton, they really wanted to get people working. They said, we need to get people working because that's going to help their economic security. So they created what we call the ABODs. Now, this is a category of able-bodied adults without dependents. So these are individuals, they're adults ages 18 to 49. They are not disabled, they are not elderly, and they don't have any dependents. So they are required to work at least 20 hours a week or be in a work training program 20 hours a week in order to receive SNAP. If they don't do this, they can only be on SNAP once for 3 months every 3 years. So think about that. 3 months, I get $125 average once every 3 years. This has been the law and the rules for SNAP since the 90s. And the one thing about this is that states can request a waiver from this work requirement if their unemployment rate was actually higher than 10%, or if they had insufficient jobs. So what happened, I will say, most adults on the SNAP program do actually work. You see that nearly 60% of adults with families work, and then we have up to 40 to 50% also work as well without children and without dependents. So most of these ABODs are actually working. So the 2018 Farm Bill was an interesting story. So essentially on December 20th, President Trump signed the Farm Bill into law. So, and SNAP remained largely unchanged. There was a lot of questions about whether it was going to be cut, if they were going to make new laws, or were they going to, kick people off the program. But hours after they submitted and signed the Farm Bill, the USDA proposed a actual rule to change the SNAP program. They basically said they wanted to restrict states from applying for waivers. So they wanted to say, okay, unless your state has an unemployment rate of less than 7%, we're not going to let you apply for a waiver. Now, I know 3% doesn't sound like a huge amount, but when the USDA analyzed what this would do, it would probably kick off about 750,000 SNAP recipients, and it would also save them 10 to 15 billion over the next 10 years. But I will say, when you think about healthcare costs, as many of you probably know, if you are hospitalized or you go into the ER, that's very, very expensive. When you think about your cost savings, you might be saving for a program, one program, but on the other side, you might be paying more. And I do just want to mention real quick proposed rules. So right now, you are allowed to comment on the USDA's proposed rule up until April 2nd. So public comments are a formal way that the public, this is not considered advocacy. You can actually write in a comment in the Federal Register. So this is an online resource. And you literally can submit a comment, and you can either write anything you want. There's a lot of organizations that have template letters. So earlier someone mentioned, is there a template for that? So often organizations will have template letters if you don't want to write your own letter, if you don't have time. You can put it actually directly into the website, or you can upload your comment as a Word doc or a PDF file. So I do just want to mention again, that is open until April 2nd. There are legislators that are asking that that be pushed back further so that they extend the timeline for when the public comment period ends. So the Child Nutrition Reauthorization Act. So this is reauthorized every 5 years, essentially 2010, 2015, and then question mark. And CNR essentially covers a lot of federal nutrition school meal programs. So this is the National School Breakfast, this is lunch, this is fresh fruit and vegetable program, this is farm to school, summer meals, child and adult care feeding programs, as well as the WIC program. So the National School Lunch Program, I think it's also important to know where this came about. This came actually out of after World War II, when we found that we did not have enough men that were actually able to fight in our war because they were essentially malnourished. They were food insecure. So they created a program to make sure that we could feed students during school so they could actually go to war if we needed them to go to war. Now, I will say the USDA operates, how the program works, and I know Patty will talk a little bit more about this as well, but essentially schools run what they do, but the USDA gets the overall what do they get to implement and what are the rules. Now, I will say it is interesting for CNR. On the House side, it is actually the Education and Workforce Committee that oversees this bill. And in the Senate side, it is the Agriculture Committee. So in 2010, we had passed the Healthy Hunger Kids Act. And this was basically a way to, this is when Michelle Obama was in office and was really pushing the Let's Move and healthier snacks, healthier food for children, essentially. And it was unanimously supported in the House, and then it was bipartisan support in the Senate. So it also formally included policy systems and environmental change initiatives in the SNAP-Ed program, and you'll be talking about PSE later today. So I won't go through all of the standards, but essentially before the Healthy Hunger Free Kids Act, we didn't have a lot of restrictions on what we could serve for fruits and vegetables. We didn't have a lot of restrictions for whole grain items. We didn't have restrictions on milk, snacks, fundraisers. We didn't have a lot of standards. So essentially what the Healthy Hunger Free Kids Act tried to do was essentially bring up standards for school meals into accordance with the dietary guidelines for Americans. However, there was a little bit what we call exemptions or loopholes. So 100% fruit juice could count as a fruit. You could have flavored non-fat milk that could be considered something that kids could consume. And also, we always joke about pizza as a vegetable. So these were called, they're combination foods. So if at least the first ingredient or a quarter of the ingredient was a fruit or vegetable, it could be counted as basically a competitive an item that was okay to be served to the children. So pizza was a vegetable according to the school meals program. So arguments for and against. So in 2015, it was supposed to be reauthorized. There were a lot of debates. People were saying that arguments for it, studies were saying that kids are eating healthier, they have less plate waste, so they're not throwing food away. There was the smarter lunchrooms movement, so they were saying that's really helping kids, direct them, nudge them towards the healthier options. Also, there was, they said, a increase in participation rate for the National School Lunch Program. Now, it's funny, the arguments against were one was there was a loss of revenue in schools. Schools said that the kids didn't like the way the food tasted, so they lost money, which hurt them. They also said that there was participation rates that decreased. Now, you have to also remember that we were coming out of a recession. So students that may have qualified for free and reduced price lunch schools or meals may, if their parents were getting jobs and they actually moved up in the poverty level scale, they decreased their participation because they actually weren't eligible anymore. There were also some studies that did show that there was increased plate waste. So we had a mix of data for that. Now, 2016, what happened was they were supposed to reauthorize. The Senate had their own idea. They did want to reduce the amount of whole grain rich foods that were going to be served in meals. They also wanted to reduce some sodium targets. And lastly, they wanted to make sure that we had more research about sodium with children until we did any restrictions, further restrictions in sodium intake among children. Now, the House went a little bit further. So the House wanted to say, again, let's reduce whole grain rich foods from 100% to 80%. And just FYI, whole grain rich foods, that is a grain that is only 50% whole grain. So when you talk about 100% whole grain rich, it's only 50% whole grains. So they wanted to go back to 80%. They also wanted to reduce sodium targets. They also wanted to make sure the USDA reviewed child nutrition guidelines every 3 years. They wanted to there was a ban on bake sales, so they wanted to repeal that ban. And they also wanted to make sure that the fresh fruit and vegetable program no longer had to require to be serving fresh fruits and vegetables. They wanted to serve canned or frozen. So essentially, this didn't pass. No one was able to get an agreement, so essentially they deferred to the 2010 law. But what happened also in 2018, the USDA did step in again. They proposed a rule and it was passed. And essentially what they did is they scaled back the 100% whole grain rich to 50%. So if you can do the math real quick, that means that whole grain rich foods in school are now only 25% whole grains. Again, if you ever want to really write great legislation, write complicated language so that people think they're having whole grains and they're really not. So now our children in schools are getting 25% whole grains. The other thing is they are delaying, again, sodium reductions, and they eliminated completely the last target 3 sodium levels. And they're now allowed to serve at least 1% flavored milk in schools. Before it was just skim milk that could be flavored. Now it's 1%. So I will say, and I know we're running a little bit short on time, and Patty will talk about this more, but federal nutrition legislation is all connected. I'm going to let Patty talk about that a little bit more later on, but I do want you to be thinking about these 3 separate areas and how they feed into each other. And we will wait for questions until later.
Thanks for your patience while we switch over. The first time wearing this headset, so it's a little getting used to. Also, if you have suit jackets that don't really have pockets, it's hard to find some place to put it on, too. So thanks for your patience. My name is Lauren. I'm really excited to be here. This is my first time being at an NLN meeting. And for the trainees in the room, I think this is a really great opportunity to network, to hear from people in the field, and to kind of see updates about current federal nutrition policies. So I'm going to be kind of continuing where Lindsay left off. And wow, that was a fascinating talk. I always learn so much when when you hear from other speakers and kind of their angle. And I'm going to go more into the advocacy side of specifically the Farm Bill. So a little bit about my background, as mentioned earlier, I worked on the Hill for Senator Kirsten Gillibrand. Who in the room has heard of Kirsten Gillibrand? Just show of hands. Okay, so a lot of you. That could be because she is one of the Democratic presidential candidates currently and running, which is very exciting. I served in her office from 2013 to 2014. So that was actually a really interesting time. At that time, the Senate was democratically controlled. It also was the previous government shutdown. So you can imagine, I just graduated from Tufts with my PhD. I start this fellowship, and right when we get into the offices, the government shuts down. And that was a short period considering the long period that just happened. But it was a really odd time to be there. However, it provided opportunity to get really lost, going from the Senate side to the House side and writing. If anyone's ever been there, there's a little like tram that connects the two, and so you can ride those. I was exploring. We were still having some meetings, but it was pretty much dialed down during that time. It was also the time that the last Farm Bill passed. So it was also an exciting time to kind of see current legislation. It had been years in the making, as kind of Lindsay alluded to, but I was there when it was actually signed, which was also exciting. And that was also the start of really talking about CNR, and there was more meetings about that going on at the time. So my fellowship was funded by the Academy of Nutrition and Dietetics. And for those that are in PhD programs, and are any of you about to graduate, soon to graduate? Okay, so one in the room. I don't know how you felt, but I felt when I was graduating that I was really burnt out from school. And the master's students in the room might also feel very burnt out too. But I went straight through. So imagine being in higher education for 11 years and then, coming to the end of it, and I'd love to hear Lindsay's thoughts too later, of just feeling like really burnt out academically. And I thought, oh, I have to do an academic postdoc. I have to do research. I have to keep continuing on this track. Or like how Lindsay alluded to, if I do something completely different, I'll never be able to make my way back. That is completely not true. I think it depends how long you want to do that, and if you're doing something that's more public policy oriented, if there are research opportunities or to continue to publish or continue to collaborate, that there are opportunities to still stay involved. So I went to the Hill and I worked with Kirsten Gillibrand, and I chose Senator Gillibrand to work with because she was on the Senate Ag and Nutrition Committee. And she's also a female leader. She is a very strong advocate for nutrition issues. And at the time, I didn't quite understand why it was so important to choose someone that was on Agriculture and Nutrition Committee, because I interviewed at a lot of different offices. And when senators and members come to the Hill, they get assigned to different committees. And really, if you're a staffer and you're working in those offices, if you're working for someone that's on the committee, that means that they are able to be in the committee meetings when they're discussing that legislation. That means that they're writing legislation that could be eventually incorporated into the Farm Bill or CNR. So there's more power if you're in that committee, especially for nutrition. So that was really important for me. And as a staffer, you learn how to communicate directly with the public and other non-academic audiences. And that skill set is really important. So it's something that I really valued because I had been in academia for so long, but you realize every other person outside does not understand the research in public health nutrition the way that we do. And so kind of working to have that dialogue was important. And you work to research, develop, and draft legislation. So as Liz mentioned, what I did for 6 months was help introduce a bill about summer meals, and that was to expand and improve the program. Okay, so what does the office look like? For some of you that have had a lot of advocacy experience, this may not be new to you. You have the member on top. You have their chief of staff. That's kind of their right-wing person. When the senator or representative is traveling in their state, oftentimes the chief of staff is the person that will make approvals in their absence. You have the legislative director. So this person is advising all the legislative assistants or LAs in their office. They have a very huge, broad portfolio based on that member's committee assignments. As a legislative fellow, I served as a legislative assistant. So the assistant that I primarily worked with was in charge of nutrition, ag, the arts. It was like a whole broad portfolio. And then I also worked with the health legislative assistant as well. You have the communications director. This person is really important. This person has a lot of weight because this person is, if you're a member of Congress, is in the newspaper, that's a really good profile for that person. So they're working to make that happen to get interviews. And then you have the scheduler, and this person should be your friend if you want to get access to that member of Congress, or if you want to get access to have that member come visit you in your district when they're back home. And then the district offices. And these people are also great because oftentimes you're not going to be going to Washington, D.C. These people are there, and they also welcome constituent visits as well. So after I did the term on the Hill for a year, I returned to Berkeley, go Bears, and I did my academic postdoc then. And I remember in that year coming back that this was kind of like a crux turning point for me. And if you kind of think back to like when you decided to continue in public health nutrition, or for those people that have a lot of a work experience in their room, what was the turning point for you when you realized, oh, this is the direction I'm going to go in? So I remember I was walking to BART, and I got a call from the Academy DC office, the public policy office. And they asked me, oh, would you be interested in serving as a legislative, in the Legislative Public Policy Committee, LPPC? And at the time I was like, oh, what is this opportunity? You know, I haven't heard about them. I had been more involved on the federal level, but not with the Academy of Nutrition and Dietetics. And what it was an opportunity to guide the Academy's advocacy strategies and public policy work. It's volunteer, and it's made of 9 members that serve 3-year rotating cycles. And the first year I joined, Patty was one of my roommates. And so it was like a great entryway to learn about LPPC and also to continue this bond that we've had for now several years. And what you do in that role is you identify opportunities to advance nutrition and dietetics in public policy and looking at grassroots initiatives. And it's about 4 to 6 hours a month, and it includes travel. So you go to DC for face-to-face meetings, you go to DC for the public policy workshop, and you have regular conference calls. So from that experience, I finished my 3-year term, I think it was last year, and they asked me if I wanted to be on the Farm Bill work group. And so from the LPPC, they have these separate work groups based on current legislation. And at the time, this was last year, the Farm Bill was coming up again. So they wanted to figure out what were the recommendations that they wanted to have as an organization. And they asked me to be chair, and the co-chair was Karen Ahrens. So I thought, wow, this is a great opportunity. This kind of goes back to that career stepping stone. So I thought, oh, this is so interesting. Like, I'm on LPPC, I get this great experience. More of my research has now turned into more research to policy, so it's going in that angle. But I would say that while I do a lot of traditional academic presentations at conferences, I also do a lot of public policy oriented talks as well for the dietetics profession. I went to the California Public Policy Workshop, I think last year, as the keynote speaker on talking about working with members of Congress. So it's really, really fascinating how that opens up opportunities for you. And if I had stayed in traditional academics, I don't know if I would be able to have had all of these experiences. So the Farm Bill Work Group had areas of practice, and how we came together was we had experts from all areas of that encompass Farm Bill within nutrition. So we had people that were hunger environmental nutrition experts, food and culinary. Our public health nutrition expert is your very own Patty Keene. We had nutrition education experts, ag and nutrition research, international nutrition, and we had 2 students that were emerging leaders, and they were wonderful. They were either dietetic interns or they were just recently graduated, but they were really vocal, and I love their contributions. So these were the Farm Bill Work Group members, again, comprising all of those areas. And the DC Public Policy Office kind of figures out who they want to recommend based on these areas. But I will say it's really good to network. It's really good to continue to speak at events and to be recognized in the field, and also to do social media to kind of share kind of your expertise, so that one day you will be like a Patty Keene and be known as like the public health nutrition guru that is asked to be on this work group. And she was also our CNR work group chair, so serving kind of multiple roles. So what does the work group actually do? So we come together, we review the literature, we looked at research, we had speakers come in and do presentations on SNAP Ed, at the time, there was a lot of discussion about what foods SNAP should offer. Should sodas not be included? Should they be taken away? So we discuss that. We have speakers. We review the science, and then we give our recommendations to the Legislative Public Policy Committee. They have to vote on those recommendations, and if it goes forward, it goes to the board of directors. And then once those recommendations are finalized, we work with our partners. So we're partners with several other nutrition organizations and public health groups. And then we work to disseminate those recommendations with policymakers. So what were our recommendations? So I just have a quick poll of hands. So in the last Farm Bill, President Obama said that the Farm Bill was like a Swiss Army knife in terms of the depth and breadth of what it covers. And there's 7 areas that are listed here: health and nutrition, research, safety net, jobs, infrastructure, conservation, and innovation. By a show of hands, I want you to think about our profession and think about how many of these 7 areas do we touch. So by a show of hands, I'm going to say, is it between 1 and 3, 4 to 6, or 7? So who thinks we cover 1 to 3 of these areas? Okay, 4 to 6. Okay, some of you. How about all 7? Yes, we cover all 7 areas. And it makes it a really broad, and that's why we have to have such diverse disciplines when we're looking at the Farm Bill and we're trying to create recommendations. But I'm going to go through them, and then you can kind of see how these all tie in. So our overall recommendations was to empower consumers. The wording for this is also guided from what messages we were trying to kind of push forward, in the sense of like what would register, or what would kind of fit with policymakers. So we want to drive demand toward healthful foods and reduce food waste. We want to ensure sound science and program evaluation for future evidence-based decision making. We want to support innovative nutrition assistance programs to improve access to healthful, affordable, and safe foods. And 4, we want to support the food supply chain so that producers and retailers create a healthful and safe food system and reduce food waste. So the goal for the first point was so we would have nutrition education programs that are tailored to participants' education levels and lifestyles to help them make lifelong healthful behavior changes. And in particular, our asks were to have sufficient funding for SNAP Ed and FNEP, to have program effectiveness in public nutrition education and assistance programs, and initiatives to reduce consumer food waste, and to support nutrition leadership within USDA and regional offices. So at the time, when we were talking about Farm Bill, there was a lot of concerns that there were going to be cuts to SNAP Ed and FNEP. So when we went on the Hill for Public Policy Workshop in 2017, that was a really big ask. We were asking to preserve that funding. Just by a show of hands, who is involved with SNAP Ed in their state? Is anyone? Okay, so there's some of you. A lot of RD professionals work within the SNAP Ed realm, and so this is an area that we were really concerned about. Ensure sound science. So the goal here is to create a science portfolio that informs development and enhancement of nutrition program content. So here we wanted to be able to continue having systematic monitoring and evaluation to provide guidance for strengthening and consumer education, implementation, and delivery systems. So what does that mean? So we wanted to secure funding for the dietary guidelines and the new birth to 24 months program. And that was part of the last Farm Bill. And so we really wanted to secure that funding to continue on. To continue to fund vital ag and nutrition research, and to evaluate funding to examine ways to improve health outcomes of low-income populations, and to strengthen linkages between nutrition programming and research through the Interagency Committee on Human Nutrition Research. Support innovative nutrition assistance. So this is SNAP. So our goal here was to have nutrition safety nets that are protected and strengthened by streamlining administrative requirements and food production. Here, the biggest ask was maintaining the structure of SNAP. So does anyone remember, this was more last year, kind of how SNAP was being targeted? Yes? You're saying? Yes? The food box. Yes, the harvest box. So that was in the news. It made headlines a lot. Everyone was very, very concerned by this suggestion to have a harvest box. And if you followed kind of the news from that, it was really interesting because I was just kind of going back to New York Times and seeing how they covered it. And it was really a distraction in a way to come up with this proposal so that if they had any cuts to SNAP, it wouldn't seem as bad as this harvest food box. Other issues that we were worried about was block granting. So just by a show of hands, do people understand what block granting is? Okay, so some, not all, but it would limit the amount of funds that states could have to carry out SNAP. And so we were also really concerned about it because SNAP, the way it is that if you are eligible based on the income standards that you receive it, but block granting would reduce that. We wanted to increase the SNAP benefit level. I mean, that was a big ask and maybe not the time that this could have happened in this administration. Update standards for healthy foods with our SNAP retailers, and eliminate the basic allowance requirement for housing for military members. And this was going through all of the other programs that Lindsay had mentioned. And really here we were just trying to maintain the structure and the funding for all of those programs that nutrition professionals are part of. And the last was to support the food supply chain. So here we were trying to support the producers and retailers to meet demand for healthful foods. We wanted to provide funding for regional ag and food access initiatives and conserve soil, water, air, habitat, and biodiversity, and really try to give farmers, especially new farmers, incentives to grow healthful foods. So if you're interested in learning more about these recommendations, one of the readings was part of the suggested readings for today. Our full report is available online, as well as our summary. And we have a separate statement on the SNAP time limits. And we have information about nutrition education programs. And so these can be used as resources if you're going to have Hill visits either in your district or in DC. And so they're all downloadable through this website, which we will provide the slides after to you. Okay, so RDs, how are RDs involved in advocacy? So I just want to show you a quick video about public policy workshop. Okay. Okay, so just to wrap up, this is the leave behind materials that are available online. So this is kind of what we create to give to members, and they're one-pagers. We also worked with the Food and Nutrition magazine to disseminate our findings in more of a lay audience. We also, the reading for today was published in the Journal of Academy of Nutrition and Dietetics, and that kind of goes through the specific recommendations that I spoke of. And then remember how I talked about earlier, how about members of Congress really like when their names are in newspapers or in print. So we often try to highlight work that we do with members to, one, bring a profile to registered dietitians, to bring a profile to the Academy, but also so we can spotlight their names and that they remember that we're the nutrition experts. And so these are just a few screenshots of press releases that we did in our work with the Farm Bill. So the Senate Ag Committee advances Farm Bill. The House passes the Academy-opposed Farm Bill. The Academy helped to organize Congressman's Farm Bill Roundtable. So as Lindsay had mentioned in that diagram, these are in-district visits. And this was with a Republican member of Congress in New York that the Academy worked with. And Congress passes Farm Bill. The president's signature will ensure access to SNAP and SNAP Ed. So this is a great a victory for all of our nutrition professionals in the room, but for SNAP recipients and SNAP Ed recipients especially. And this is Patty, and I told her I was going to take this picture. When you do have visits or when you do work on legislation that has taken years to get towards this outcome, it's always important to thank your member of Congress. They really appreciate that. They get so many requests a day that it's nice to get a thank you and that they will remember you. So how can you help? So we are all experts in the room. it's really important to explain the work that we do and put it into context for these members of Congress. There are resources available online, and it's just important to be able to connect with your members in district and at the federal level as well. If you are a member of the Academy of Nutrition and Dietetics, there are action alerts. So these are the pre-filled emails that was mentioned earlier. We had one recently on the Farm Bill last year. There are others that come up around diabetes or obesity, and it takes about 2 minutes to fill them out. It's all pre-registered. If you put in your name and your zip code, it will populate it for you, so it's very easy. This is where you can find the Action Center. And then there are other organizations within maternal and child health that have advocacy arms. So the Association of Maternal and Child Health Programs, also the National WIC Association. So I know that there's several people that work in WIC here. They also do advocacy too. So if you want to join their listservs and kind of see and follow what they're doing, their resources are available online. This is my contact information. Thank you so much. I'm going to pass it over to Patty to wrap things up.
Oh, I move around a lot. I need to be here. Ish. I'm not going to take a lot of time to talk because we really want, and so pay attention. We really wanted to leave time in our time to have good discussion and have lots of questions from all of you. But so I'm just going to sort of take what we've already learned from Lauren and Lindsay, which has been so great. And I know it's sort of a lot of information, and so it can feel a little bit overwhelming. And also you can probably feel a little bit like, where is my place in all of this? Because I'm not going to go work in a senator's office, and I'm not necessarily going to do all these kinds of things. But and these are my disclosures, which are probably helpful for you to know. Lauren and I both obviously have had a lot of leadership experience that was honed through the Academy of Nutrition and Dietetics. I do not work for the Academy. I serve them in a strictly volunteer capacity. And as Lauren mentioned, I was on LPPC for 3 years, and that was when I chaired our CNR work group. And then right now I'm actually on the board for their PAC. So for the Academy of Nutrition and Dietetics Political Action Committee, I'm on the board for them. So I do have that affiliation with them, and we sort of still connect on the Farm Bill work group and CNR as well. But what I did want to mention, so we all kind of have come at this work from different places. And any of you who know me well know that this is a second career for me. I was a baker my whole life until I was 31, and then I went back to school for nutrition. And so in the course of that, and part of what kind of sparked that for me was that I was really interested in school nutrition and school food and what was happening there and what the policies looked like. That was like the little glimmer of policy advocacy that I had when I started coming into nutrition. I had done, advocacy stuff in high school, but I had never been on a Hill visit. I had been to DC once for a protest when I was 18, and that was the extent of it. And then what happened was, for me, and I'm from New Mexico, a tiny, teeny tiny little affiliate. And our public policy coordinator, who was serving for the affiliate, had to step down. And so they needed to fill it. And I was a fresh dietitian. I was, I think, like 6 months since I had my RD. And they asked me to be the public policy coordinator. I had no idea. I had no idea what I was doing. I was interested. I was paying attention to things, but I was not where I am now, and certainly was not ready to go work in a senator's office. But it was really through that, and also this was because what really and it was in the video, and Lauren showed a picture too of my then congresswoman, who is now our governor in New Mexico, and how we really worked on developing a really good relationship with her and her office. And part of that, because of that, was because she was on House Agriculture. And so, as Lauren mentioned, it's really important to know what committees folks are on. And I'm going to show you it at one of my last slides, actually, is knowing the committees of jurisdiction for CNR for those of us in the room from the partner states. Wherein I do have a slide so that you can kind of fast track and identify your member. But so what I want to do right now, but let me finish. But so, sorry, I said I was going to be really. So I was asked to be public policy coordinator, and I loved it. I loved doing it. It gave me a lot of new skills. I met a lot of really great people, both in my state and then in DC, because you go to they send you to DC every year to do this work. And it was excellent leadership experience from very trusted folks and very supportive, like, because it's scary when you feel like you're going to make a mistake. And so it was a very safe place to make those mistakes. And so because though of that relationship, and because someone thought I maybe had a little bit of skill there, then that was when they invited me on to LPPC, and that really catapulted everything forward. And so certainly it's something that, like, obviously, like, I'm somewhat good at it. And so that's why that's been cultivated and supported in the way that it has. But definitely, and it doesn't have to necessarily be the academy, but find, if you're the slightest bit interested, find those places in your profession, in your associations, whether that's National WIC Association or wherever it might be, to really sort of think about what's the first step for you. Because the first step for you might look really different than the first step for a lot of us. So start with where you're comfortable. Anyway, so what we wanted to do was sort of tie everything a little bit up tightly, thinking a little bit about how many of you were here last year for NLN last year? Okay. So you'll recall that last year, and if you weren't here, it's okay. You missed a great talk by Angie Tagtout. Lots of great talks, and you can watch them on the YouTube channel. But one of the things that Angie talked about a lot last year was the importance for us as a profession to make sure that we are continuously supporting and talking about how the Dietary Guidelines for Americans impacts our work and how we utilize it in our work and how it's utilized in these larger programs that we're all a part of, or that the people we work with are a part of. So wanting to sort of, think that through a little bit and make sure that we're kind of tying this back to dietary guidelines, because as much as we have to be paying attention to threats around Farm Bill and CNR, we absolutely have to be paying attention to the threats to just the dietary guidelines themselves and the dietary guidelines process. And I'm not going to go into all that because Angie did all that last year, but I want to make sure that we're kind of keeping that on the top of our heads. It feels super basic sometimes, like, oh, it's just the dietary guidelines. That is the foundation for everything that we do. So when we look at, and this is not a scientific rendering, this is me sort of looking at, okay, this is about, how when you look at this bottom, so the dietary guidelines for Americans is the foundation of this house, this funky looking house. So they, all of those programs on the bottom all have nutrition guidelines that are informed by the dietary guidelines, right? So it's school meals, school breakfast, WIC, CACFP, those ones in that sort of lighter blue, this is everything that for the most part falls under CNR. Everything in that purple is what falls under the Farm Bill. So like every one of those programs, for the most part, is touching the folks that we're working with. And then we also have the Older Americans Act programs, which we don't necessarily talk about within the MCH population, but so that's congregate dining and home delivered meals. And so these also have nutrition guidelines that are under nutrition guidelines that are, again, informed by the Dietary Guidelines for Americans. We do, however, and this is certainly very true in New Mexico, I don't know how true it is in all of your states, you know, we have a lot of grandparents who are raising their grandchildren. And so it's also, even though we're MCH folks, it's really good for us to be familiar with and ready to advocate for those nutrition programs that impact older adults, because if we're supporting their nutrition, then we're also likewise supporting the nutrition for the kids in their care and the families in their care. So just thinking about how the dietary guidelines really in some way impacts all of these programs and really informs the guidance for them. The other thing about the dietary guidelines for Americans is now we in public health and in my world, we've known about socioecological model for a long time. Is everyone I'm assuming everyone knows here about socioecological model. So we've known about it for a long time, right? So the evidence has been there, et cetera, et cetera. But that evidence, if you look at the dietary guidelines for Americans from 2005, were they talking about this stuff? You're all too young, right? But guarantee you, in 2005, they were not talking about the impacts of policy and cultural norms, really, in the dietary guidelines for Americans. It was very much focused on individual behavior. But we need the evidence. So if you're doing research, right, we need those research projects, that evidence building, that evidence base, to then inform the dietary guidelines. So then this appeared in the 2010 dietary guidelines. It was chapter 6 of the dietary guidelines that the socioecological model appeared in the dietary guidelines to recognize that there were these other impacts other than individual behavior on our individual dietary and physical activity choices. So as such, once it's in the dietary guidelines, then what happens? Anybody know? What's supposed to happen? Because all of these federal nutrition programs are supposed to be in alignment with the dietary guidelines. So that's why suddenly we're seeing changes to programs like SNAP-Ed, which I know not many of you raised your hands that you're working in SNAP-Ed, but know that SNAP-Ed is the largest nutrition education program in the United States. It cuts across all sectors and populations across the lifespan. And so if we're moving from individual educational sort of ideology and moving towards looking at more systems change and policy change, and we're going to talk about that all afternoon, I know, that's extremely significant. And having it in the dietary guidelines then opened up the floodgates for that to happen. So SNAP-Ed, really quickly, SNAP-Ed, every year we get SNAP-Ed guidance. So every year it's updated. And then implementing agencies like me and other folks, whoever else might be in this room too, we have to then implement SNAP-Ed in our states, modify SNAP-Ed, what our approach is, et cetera, based on whatever the new guidance is. So when the project that I have, Chili Plus, which those of you who have been here for a couple of years, I've talked about when we do our abstract sharing and things. So that was originally a research project that was focused on multi-component, multi-level intervention, looking at, not just individual behaviors. And when I applied to then, because that was NIH funded, so then when we applied to do it as SNAP-Ed in 2011, we couldn't do all of those parts. We couldn't do the grocery store component. We couldn't do the WIC provider component. We couldn't do the other healthcare provider component. We could only focus on what was happening in this case in Head Start programs, because that was direct education. These other policy systems and environmental change efforts were not allowable. So this was 2012. So remember I said the 2010 dietary guidelines came out, which technically they didn't come out until January 2011. But they still call them the 2010. But so those came out in 2011, and then it takes a little while for catch up. Remember, just like Lindsay was talking about, policy takes a long time. So policy takes a long time, but then also the evidence takes a long time to get into the policies, those, guidance documents and things like that in order to push it forward. So anyway, so in 2012, it was not allowable. In fiscal year 2012, it was not allowable to do that work. Then the evidence starts to catch up because the guidance doesn't happen, doesn't get written on a dime as soon as the dietary guidelines come out, right? So there's these lags. And so then finally in 2013, so what was super annoying was, so we had this beautiful program that when we wrote the SNAP-Ed application, we had to take it all out because we couldn't do those pieces. We had to take our program apart because it didn't fit, even though we knew it fit the evidence, but it didn't fit what the guidance was from USDA. So we had to take those out. And then the next year, it was allowable. In 2013, it was allowable. We were like, we wish you would just let us do it the way we always wanted to do. But anyway, and then over time, the guidance within SNAP-Ed, so now here we are, 2019. Each year it was a little bit more that it was either allowable or yes, we want a state to do something. And then now all states have to do policy systems and environmental change work in their SNAP-Ed programs. It's a requirement. There's no way to not do it. So this is why the evidence, the research that we're doing, the evidence that we're doing, and the advocacy that we're doing is so critical, because policymakers need to understand the dietary guidelines for Americans. They need to understand the evidence base. They need to understand what we do and why we do it, and understand that this is what then eventually funnels down to impact the populations that we really care about. So this is what what the socioecological model and SNAP-Ed guidance looks like. And I won't go into this because I know we're going to be really exhaustive around PSEs today, which are not necessarily SNAP-Ed. But and then the other thing is this also impacts evaluation. And so now the SNAP-Ed evaluation that was adopted is all states have to adhere to this SNAP-Ed evaluation framework. And the other thing that this came out of was that with the 2010 CNR, so this is something that nutrition policy wonk people would know, but so 2010 CNR had to be cost neutral. And in order for that to happen, they had to get the money from somewhere. And so where it came from was they capped SNAP-Ed over time. And what that SNAP-Ed had historically not had the best overall evaluation plans. And so this really kind of lit a fire under SNAP-Ed folks, because so even though they were sort of at unfortunately CNR and SNAP-Ed, which are of course aligned programs, the SNAP-Ed essentially lost funding as a result of the Healthy Hunger Free Kids Act in 2010. So they got to work and developed, and it took many, many years, but developed the SNAP-Ed evaluation framework. And so again, this is where all of those PSE efforts, so it's not just about individual dietary change, it's all around the PSE efforts as well. I want to remind you, this was Angie Tagtow's call to action last year. So we are at a time in which we cannot take federal nutrition guidance and nutrition education resources for granted. However, we're at a time in which our collective action, our stories, services, publications, our research can create the most impactful evidence on the human health benefits of a healthy eating pattern. These contributions can profoundly impact nutrition policies, practices, and programs. So this is also, again, thinking about where do I fit, what's my entry point. This is just for you to look at. This is an excellent case study that Center for Science in the Public Interest just put out. That's a case study on what the advocacy process looked like for the 2010 Healthy Hunger Free Kids Act. It's extremely helpful to understand that history as we're moving forward into the next reauthorization, as Lauren talked about and Lindsay talked about, that's going to be more than likely in 2020. And so they have great infographics and things like that, but they have a really nice little case study that I would encourage you to take a look at. Just moving forward right now, today, if you had to go out and talk to a legislator about child nutrition reauthorization, because this impacts pretty much all of us in this room, is the diets, if we just focus on problem, solution, ask. So the diets of most children fall short of recommendations for good health. The solution for that are the child nutrition programs. We can mobilize that infrastructure to improve diet and health on a national scale. And then this always resonates well with teachers and school principals, is that it improves school attendance, test scores, and educational attainment. So the ask. So again, if you got into an elevator, I was in DC last week, and I literally ended up in the elevator with Rick Scott, who's the new senator from Florida, who was the governor. And he's not my senator, but I knew all our SNAP Ed people were there, and so I just gave him like a 2-second spiel on SNAP Ed. So that's why they call it an elevator speech, because you will at some point potentially get stuck in an elevator with someone. And so the ask would be support and strengthen child nutrition programs. These programs provide meals, snacks, and nutrition education that will support healthy children who would develop into healthy adults. That's all you need to say. That's all you need to do. That's not even terribly political, believe it or not. And one thing to note, House Education and Workforce, it was known as that for years. Now that the Democrats took it over, they've changed the name to House Education and Labor. So now it's House Education and Labor. So if you see it listed as House Education and Workforce, know that that's changed. But I want to point out, so I want you to find your find your legislator on here, and you have the slides, they're posted. House Education and Labor, so of the 50 members, we have 4, 8, 10 members who come from these states, the states in this room. We only, unfortunately, have one. Out of the 20 members on Senate Agriculture, we only have one. That's Michael Bennett from Colorado. But so this is the Committee of Jurisdiction from Child Nutrition Reauthorization. These are the folks those of you in the room, if this is your senator or your representative, start talking to them now, meeting with them now, reaching out to them now, sending emails to them now, just even if it's just letting them know what you do and where you work and why your work is important. So wanting to point those out. One of the things that's exciting, Kim Schreier, I'm not sure if that's right. Is that anybody's representative from Washington? She's a pediatrician. She's newly elected and she's a pediatrician. So get talking to her, because I'm guessing that she'll be a good champion for us. There's certainly lots of champions on this list. Okay, now how much time do we have for questions? Okay. Sorry, done. How are we gonna do this? Pass it around? You can just pass it around. Yeah, that'll work.
I also for ASP. We have student memberships and we have a policy committee. We do not have the resources that the or NJA has, but we have a very active policy committee that is focused on public health nutrition. So I encourage any of you to become members. Sandy's going to speak. I just wanted to put that out there. That of course. So my comment question, and this don't miss supporting the Farm Bill. I think it's very vital, but none of you addressed corporate consolidation there's so many issues with that, with food workers and make profit from the SNAP benefits, but yet they're paying low wages, and kind of the impact on food and farms. I mean, there's so many pieces of that, but none of you address that corporate piece and how it's shifted. So I just want you to because I don't really see that very much, and just how we need to advocate for strong nutrition and know that the research, for example, most of it goes to foods, and we know that's not supporting health. So, all those pieces.
Yeah.
That's a big question.
I guess since I'm
The question.
sorry, so the question was, we're playing a game here today. So the question is basically, in all of our presentations, in the Farm Bill, we did not discuss how corporations within the agricultural and farming community have been engaged in getting larger and larger, and how that's impacting lower income individuals, smaller farmers, smaller retailers. I would say, coming from a land grant university, NC State, this past Farm Bill, and I will say they do have a lot of training programs and also grants. Now, granted, grants are not always the answer, but they do have grants for returning veterans. They have grants for vulnerable populations, so small farmers, minority farmers, or farmers of color, if you would prefer that term. I do think it is an issue, though, and I will say, we always want to say that we want to support, small, medium-sized farms, because the majority of our farms in this country and the majority of our food in this country are run by large farms and large groups. It's very, very hard to organize smaller groups into one big group in order to pass that piece of legislation. I do think what you can do is talk about the importance of local economies. Right now, you have a administration that is very interested in small and rural economies. So I would say, if you need a message or a hook, your hook is going to be support small businesses, support rural, and also small farmers. I don't know if that answers your question, but it's the best I can it's the best I can do. It's an accurate statement, but I do think continue pushing and trying to support and lift up our local and smaller communities.
I think the other thing I might just add really quickly too is that sometimes it depends. Well, it always depends on the mission of the organization. So sometimes an organization may not be able to carry that water, but you partner with other people who can. We have issues with this of course, in the emergency food system and the food bank world, right? Where a lot of the solution to hunger is to alleviating poverty, right? We're not going to food bank our way out of hunger. But food banks very often, even those who are strong advocates and have a good advocacy network, are not necessarily going to, and this is a system problem for sure, they're not going to be able to address minimum wage, for example, because it upsets half their funders. So absolutely, we need to be looking at those larger systems issues. I think as far as like what you can do tomorrow, and going out is if who you're with or who you're affiliated with, if you can't necessarily address or come out in an official capacity around a lot of these more social justice issues, find an organization that is, and see how you can help them, and they can carry that water for you if you're not able to do it within your own capacity. If you can do it, though, absolutely do it. I think also, and it depends again, and this is like the mission and the goal of the agency, but if they're just focused on nutrition, oftentimes it can be a challenge to see outside of that and to see how those other issues are impacting nutrition. But even one of the things that we had sort of internally advocated for, because work requirements, for example, with SNAP can feel a little bit difficult to message for nutrition folks, especially if your political beliefs may align with more a different side that does feel that work requirements are, a really good idea. And so it was important for us to be able to provide good evidence-based messages for what the challenge of work requirements can be and why really strict work requirements, particularly in economies that are not growing very well, are deleterious to nutrition impacts. So that's the other thing too. I think is finding what the nutrition answer is for a lot of those in that way. If that makes sense. So for me, just the first thing that popped into my head. So in New Mexico, we have extremely high rates of child hunger, and so we can kind of toss around which number we think is the most current. But one of the things that I do often is with policymakers or really whoever. So we have as high as 40% child food security in our state. So I ask them to picture 10 kids that they know and love and or that live on their street or whatever, and think about, okay, which 4 are you okay with not knowing where their next meal is coming from? So that's one of my kind of go-tos, because it makes them think about it. It makes them picture their kids, their grandkids, their nieces, their nephews, whoever that might be.
Yeah, so the question is essentially, what are our elevator pitches? What are our elevator speeches? I will say I phrase this depending on who I'm talking to. If I'm talking to someone where I think I'm going to appeal to their social aspects, or if I want to appeal to their financial aspects. So my pitch is usually food and healthcare are connected. So if I'm talking to someone who's more of a fiscal conservative, I will say we can cut food assistance programs, but you're going to end up paying more later in healthcare costs, because we know that most low income individuals are on publicly funded health insurance. So guess what? If they have to go into the hospital, you're going to pay for it anyway. So we can invest now, pay less, or we can invest later and we're going to pay more. If I go into someone who's maybe more socially interested and worried about the public's health, I'll talk about the importance of, food and health is connected. We need to know that there are going to be programs to support low-income individuals, because we don't have that. They don't have a way out to achieve the prosperity that we want them to achieve. But I would say those are my two elevator pitches. I do want to make a comment, because there was the statement about block grants. For anybody that likes to use taglines, and this is what I would use in DC, I always say block grants equal blocked opportunities. They essentially cut your opportunity to serve your population. So top liner there. But I will also say work requirements don't always work. Another one. But
You're hearing from some social media experts that Twitter a lot. So I am also going to phrase it in depending on who you're talking to. And when I was working in a Democratic senator's office, oftentimes we're trying to get buy-in from Republicans. So how did we get that buy-in? It was a bipartisan bill in the end. We talked about streamlining administrative burden. Any type of reducing red tape is always helpful. And then, as I think Patty mentioned earlier, test scores. So if we talk about school meals, the importance of feeding kids, and how it's like school breakfast, for example, how it is associated with improved test scores, that really resonates. So if there's anything that you can do to tie nutrition with educational outcomes, I often find that resonates a lot better, even more so than prevention and public health.
So the question was regarding specifically school meal flexibility, and the recognition that some schools have struggled with implementing the new requirements, and what's the best way to sort of dialogue with local stakeholders. Is that kind of the gist of the question? So I think absolutely being able, and I don't work that much directly with schools in that way. Most of my work is in the early childhood space. But what I do know that has been successful, and we have a wide range in New Mexico because we have very rural schools that definitely do not have dietitians in within a 100-mile radius, much less working in those districts. And so I think listening is so critical. Recognizing where how can we build better coalitions in order to hear what all those needs are and access the resources that are in play, whether that comes directly from USDA. I also would look to your state agencies and see what levels of support and technical assistance are being provided there. We have not historically had good support in New Mexico, for example, in the state agency. I'm hoping with our new governor that will change. And hopefully that there will be, a better guidance there, because we do know, and we certainly know this from SNAP-Ed and from CACFP work, is that if there is good technical assistance that's provided, they can really help. They help with best practice and all those things. But certainly recognizing that there are vast differences in across communities, even within the same state, that make those challenges more difficult. But also and providing good examples of where it works well. Making sure that your focus, strengths-based approaches to here's what, this community did, and here's what this school district did, and let me show you these pictures. Have you seen this video? And, finding out I think that's something too that, when we're thinking about good projects to be doing with students, are there other areas in the state that we can be working to provide that kind of guidance to schools who may not have the nutrition background to that help sort of, I think that's the other thing, and I'll stop talking, but is that's one of my arguments for why it's so important to have nutrition professionals in child nutrition programs, because we have a different foundation in some ways, where if our foundation, our code of ethics, particularly for dietitians, requires that we are considering the health of the public at all times, that is a really strong thing to come back to an administrator who's complaining about our food budgets. And that makes it easier to be part of a network like this or other types of those networks where we're really saying, no, nutrition really matters. It really is important. Sorry.
I will say that was one argument that I had to, when I was in DC, I had to address almost every day is we're losing money. Schools do have to work on a balanced budget under their school meal programs. So one thing that is a couple points that we would like to make is that the USDA does have technical assistance grants, and they are underutilized. So schools don't use the resources that are available to them. Sometimes it's because they don't know they're available. Sometimes they just don't have the time. So I think one, making them aware of that, and that's something that you can all do in this room. Also partnering with other organizations or programs. So SNAP Education, we can go into that school. I think a big thing, and we tried to talk again business-wise, behavioral economics with these school nutrition directors, making sure you have your healthier foods or the foods that you're required for the children to pick up and eat, to make sure that they look pretty. We found small things like, guess what? Girls that have braces don't want to eat apples, whole apples, because guess what? They get stuck in your teeth. Slicing up apples, so much easier to grab that. And also placing things, as kids are checking out, making sure that you hide things, making sure you highlight, or I think really trying to talk to schools in a business dialogue. I think that financial, what you said, going after the financial number. Let's think of a school cafeteria as a business, and how do we get our customers or our students to choose the foods that we want and they know they should be eating is the best way to go around them. And I would just say the school flexibility, it is, that is schools can now, it's a final rule, so they don't have to follow anything else, but that is their standard. They can go above and beyond. But if you want to encourage your schools to do better, be better than what we have at the rule, you are more than welcome to do so.
The other thing on those team nutrition grants that Lindsay was talking about, those TA, is that those and that was something that came up in our CNR work group. So Claire Miller, who is from Louisiana and was a long time with USDA child nutrition program, she said that was always so frustrating, is that because once states apply and get a team nutrition grant, then they have the capacity to keep applying for those grants and maintaining those grants. And so states that don't have that capacity and just don't within their state agencies typically, because it's usually whatever state agency is overseeing those programs, don't necessarily have that within their agencies, and so they're not applying. And so and I'm not part of the state agency, but I, reached out to the state agencies and said, I will write the grants for you. Like, I will write them. And they just won't do it. And that was part of the leadership at that time. And again, I think that's going to change. But that is another avenue, is to find out if your state is not accessing team nutrition funds, why not? And how can you potentially help?
Okay, so I think we're wrapping up. We will be here for the break. So if you have any questions that you want to ask us afterwards, I know Lindsay and I will be here also through lunch. So if you want to come up and chat with us as well. Thank you so much. And Patty is here the whole time. Thank you so much for your participation, and we really appreciate being here today.
I just want to thank Liz, Lindsay, Lauren, and Patty for their excellent presentations and information provided. Just want to seed a little thought for you while we'll take a 10-minute break, even though I know we're slightly behind. But a lot of mention here about non-traditional partners. We're going to focus on traditional partner you would like to get more in touch with to help move nutrition along that continuum. Okay? Have a great break. I'll see you in about 10 minutes.
How late are we?
We're good. We're 10 minutes into the break, but we'll pick it up on the other side. And if we're a little bit late to lunch, it's not the end of the world.
Yay!
Really nicely
Even
done.
with the
Thank you.
technical
I know.
delay.
Oh, good.
So I think actually.
Question: are we gonna be back soon, or let's go to break? Sounds good.
Ready? Test, 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 testing. Test. test. Test, test, 1, 2. Is pro. Getting it. Test, test, test. Okay. Testing. Test. 1, 2, 3. All right, test 1, 2, 3, 4, 5, 6, 7, 8. And now it's not coming. All right. What was that? Sorry, you broke up. Test. Yeah, test 1, 2.
Hi, everyone. It is time to come back to the table. Come on down. We're going to hear about PSE concepts in unique environments. You're going to want to hear it. Grab your snacks, your coffee. You will not be asleep. We get to draw during this session. You're going to like it. I do. I don't have to hear my Mickey Mouse voice. I sent it to you again. Yeah, see if it comes up. Wow, they're really obedient. You guys are good listeners. I don't even have to like clap my hands or anything. I love it. Did it come through? Crap.
Oh yeah, let me just use your phone.
You can try. I think it's a dumb thing to download.
Mm. It is my pleasure. Is everybody ready? Great. It is my pleasure to introduce Adrienne Udarbe. Did I say that correctly? Adrienne and I have met before, actually, at Public Policy Workshop. Are you sensing a theme? But Adrienne is a registered dietitian nutritionist and received numerous national and state recognitions as a nutrition leader. She is a social innovator fueled by a passion for advocacy and good food. Her career has been dedicated to prevention work with over a decade of experience working with government, nonprofits, and healthcare groups. She excels in facilitating collaborative solutions to complex challenges to shape healthier communities. We're very grateful to have her here today. Adrienne is the Executive Director for Pinnacle Prevention, and please welcome Adrienne.
Thank you. Good. Okay, can you guys hear me okay back there? All right, wonderful. I love seeing so many folks from Arizona here in the room. As Patty mentioned, we are based out of Arizona. Pinnacle Prevention is a nonprofit organization that serves Arizona statewide. We focus on food systems and active living. I have extensive background, though, in public health. I worked at the state health department for many years. And you're going to learn more about that and hear more about me as we go along as well, too. So it's a pleasure to be with all of you. And hopefully what I'll be able to discuss with you is really going to build off of the amazing things that were shared this morning. When we hear the topic and the concepts and the theories around PSE, sometimes it's really challenging to take it from theory into action. And it can also feel very overwhelming to even think about where to get started. So then we just kind of hit a wall and we stop. So hopefully I'll be able to share with you how this looks and gets put into action, but then specifically some of the unique considerations that you will have to make if you're going to be working or doing any work in rural environments and with tribal environments and in communities of color, and some of our experiences that I can hope to share with you as well. So to get us started, I wanted just to frame the content of what we're looking at and how it plays into the roles of the work that we're doing. So we're going to do a little journey mapping activity. So for those of you that are here in the room, you're going to see some papers and some pens on your desk. And it was alluded to in the previous presentation that much of this, when it comes to policy work and even system work, is rooted back into individual values and our own experiences. So we need a moment to reflect on what our own values and experiences are, so that we can think about and start reflecting on how that starts to take shape in our PSE work that we're doing. So what we're going to do, I have the journey map that's shown up here, and I have my own personal journey map that you are going to see right here. And I want to tell you a little bit more about myself and how it shaped who I am today and the work that I do. So I was born and raised in Lake Tahoe, as you can see as we start out there. I consider it a smaller rural community. For those of you that are familiar with Lake Tahoe, it straddles the California-Nevada side. So I affectionately call myself a California girl, but then I also, with the right audience, will be like, oh, I'm totally a Northern Nevada girl as well, too. So born and raised there. And from Lake Tahoe, our family left. My family was actually, my parents worked in the casino and gaming industry, which then took us to Las Vegas, where I decided to do my undergrad. With respect to environment work, Las Vegas is like the perfect little petri dish of where you can try different things and impacts on an environment that is not like any other environment in the world. During that time, during my undergrad, I became a young mom and I had my daughter. And that is what I actually say launched me into this work, into MCH. Because I was a nutrition science major, I always thought I would do work in research. And then when I became a mom, I knew how powerful that work was in connecting with moms on nutrition messaging, what happened when they were eating, when they were pregnant. And so that totally changed my trajectory of the work that I was going to be doing. So when I graduated, I moved back here to California, and I immediately got a job in WIC. And then that is where I fell in love with public health. And, you know, once you're in WIC, you're kind of always in WIC. So it's so great to see so many WIC folks here in the room as well, too. And those experiences and talking with moms truly did shape then my understanding of the struggles of what folks were going through. Because in my own white privileged mind, I had this idea of how folks should eat. And in school, the textbooks told me this is how folks should eat and this is what it should look like. And then when you get thrust into a community of people that are in the struggle, you start to learn very, very differently that things don't happen like a textbook, and it also doesn't happen how I've been raised to believe that things should be. And so then that continued my path and my journey. Then we decided to move to Arizona. So our cost of living out here in California got a little bit too much for us to handle. So we said, let's try sunny Arizona. And 12 years later, here I sit now in Arizona, and I'm a huge, huge, big fan of Arizona. And when we moved to Arizona, that's when I started my path at the Arizona Department of Health Services, so in state public health. So I'm coming from that local perspective in WIC, and now in the state perspective. And this is when I'm starting to see the influence of systems and how, you know, sometimes we want this to happen, but all of these hoops that we're having to jump through, or all of these rules or these regulations or these different things that we ourselves are creating are sometimes the barrier that's preventing folks from being able to live their best lives. So I'm starting to see this, and it's all starting to connect, and it's all starting to click. And at the same time, as many dietitians do, we wear many hats and we work multiple jobs. I was also doing home health and hospice on the side. And so I would go into people's homes. Typically, this was now on the other end of the spectrum at end of life issues is when I was seeing folks, and I was getting a whole other perspective of what was impacting and influencing their decision making. And I would get there and I would knock on the door, and you know, one of the guys that I remember so affectionately was a retired vet who was wheelchair bound. And when I opened the door, I was sent there by the doctor who gave me an order and said, this guy's non-compliant. He really needs to control his diabetes. So you're going to go in there and you're going to fix that. And when I arrived, he opened the door and he's like, oh, the dietitian. I was like, it's great to see you too. And he goes, I already know what I need to do. I already know how I need to eat, but how am I supposed to get to the store when I'm stuck in this wheelchair? He was recently housed, formerly having been homeless, and was not in an apartment that was compatible with his needs, so he had a lot of struggles being able to cook in his apartment. He had limited funds to be able to get the food that he needed to get as well too, and it was this kind of Shangri-La moment where all of that started to come together, where I said, okay, there's got to be a better way. And I was limited in that role in government, so I left and became a founder of Pinnacle Prevention, which is the nonprofit that we work for today that really tries to tackle those gap areas, which are the policy and the system areas that sometimes we can be limited in the government role, but then also wanting to uplift my colleagues who were in that government role to say, how can I share your message and your voice in this new capacity, in this new way? So that's my personal journey. And for good or bad, it shapes my lived experiences and my perceptions and my values that shape my policy work. So I want you to take, this is going to be very brief, 5 minutes, take those markers. You don't have to be amazing artists. You can use words, you can draw pictures. I want you to map out your own journey that shapes your work and how you do your work today. So take a few minutes to do that. Please. Love it. And I see some of you being very intentional artists. I'm going to say you're going to have to be a rapid artist at this point, so get as far as you can possibly get. I'm going to give you 1 more minute to get as close as you can, and then you can keep working. You can absolutely keep working while we continue the conversation, too. Okay, so just for time's sake, we're going to continue on. Keep, being artistic and creative as we continue the conversation. And what I do want you to do, since for time's sake we don't have time for everybody to share, please hold on to those. And I hope during the lunch conversation you're able to share your journey with your colleagues at your table and have conversations around that. And we're going to revisit why this experience is important as we continue in this discussion together. So with that, typically when we're thinking about the policy impact side of things, we think about, there's an opportunity to impact policy at the federal level, which was definitely focused on in the earlier discussion this morning. But then we also have to think about the state level and then the local level. And much of the work that we do at Pinnacle Prevention actually impacts all three of these levels, with a huge impact at the state level. So just know, if you're starting your journey into this world and you're trying to figure out where that might be and what that might look like, you can do all three, or you can focus very, very locally at that local level as well too. And I'll be sharing some stories from Arizona about what that looks like. But one piece that's often missing from this equation and from this puzzle that we don't talk about as much is that tribal piece that you'll be able to see right there. And all of our states here have amazing tribal communities. Arizona especially, that stands out. We have the third largest tribal population in the United States. California, just by sheer size, happens to have the largest, but we have one of the largest tribes in the United States, which is Navajo Nation, which actually straddles and over into New Mexico, up into a little bit into Colorado as well, and into Utah a little bit. But mostly there in the New Mexico and the Arizona side with Navajo Nation. And so I'm going to share some stories about my work that I've done with them. But when we think about those that are in the struggle, what we often have seen, the dialogue has been folks of saying, well, where are the tribal partners? Why aren't they at the table? Or this is what we know is their issues. And what we want to do in this work is to be able to say it's not us and them or there, but let's bring them to the table and allow them to share their story and their experiences of what this actually looks like. And then how, as allies, do we come to the table to be trustworthy and respectful to honor that work? So we'll talk about that too. So just to give you some context, these are our tribal homelands that we have here in Arizona. As you can see, up there in the corner is Navajo Nation. But then in the center of that, we actually have a whole other tribe, which is the Hopi tribe. So Navajo Nation is kind of enveloped and surrounded the Hopi population, but you'll see them there. And it goes all the way down south. And of course, as as it's been colonized, you have these state borders, but it transcends down into Mexico, and there's lots of beautiful overlap in the cultures and the families that we work with and what that looks like. And when we say tribal policy, you cannot assume for any reason that how you've done things or what it looks like for one tribal organization would be even remotely close to what it looks like for another tribal organization. So if you do have an interest in going into that work, you truly have to get to know and build relationships within that distinct tribal community that you do want to work with. So this is Navajo Nation. I'm just going to focus on that one a little bit, as I mentioned how it crosses over into other state borders, of course, and how you see it laid out. Typically within Navajo Nation, they have several different chapters. They have about over 100 different chapters that you might work within. So they have an overall tribal government. They have a president, and then that breaks down into chapters, and those chapters are there. And then you can kind of also see by color how they break it out into different regions as well with respect to the work that they're doing there. So I want to do like a big P policy of what that would look like when you're working with tribal communities. So how many of you have heard about the Healthy Nation Act of 2014, otherwise known as the junk food tax? Amazing. Like, this happened and all of us in the nutrition world were like, what? This is amazing. And this is something that we follow very closely. And this is the president at the time that was signing this act into law, which basically was, one of your first junk food taxes on this bigger, larger scale. We've seen it now transcend itself into sugar, sweetened beverage taxes in different communities in different ways. But this is one of the first of its kind that is still in place. So this was driven by the people, by the community, and is still in place today. And from that, those taxes, they filter out those funds down to the chapters, and the chapters can implement them for health-based initiatives in lots of different ways. So for example, you might see it manifest itself through gardening classes that they're doing with this funding out in the community. Lots of different things that is unique to that distinct community that they're working with. So that is big P policy. When working with the tribes, it takes a long time to establish trust with them. And oftentimes, many of you are coming from academia. What's happened in the past is that academia loves to research. And so they want to come in and they research, and you get all this information, and it's actually done harm and damage over the years. It's a lot to overcome. And if you're going to go in and ask a community what their needs are and what their challenges and their problems are, if you're not going to do anything about it, then don't do it at all. It does harm. And so the most important piece is that they know that if you're going in there asking questions and assessing the environment and all of these different pieces, that you better plan to be there for the long haul to help them move along that pathway of doing something about it, and not what Adrienne thinks they should do about it, but what the community thinks that they should do about it. So one of the homework pieces that was shared was the food sovereignty assessment piece. That wasn't the tool itself. There's tools that exist, but that piece that was shared specifically was 3 different perspectives from different community members who implemented the food sovereignty assessment within their own communities, and their perspectives about what worked and what didn't. And why I thought that was so valuable to share, if you haven't read it or when you get a chance to read it, is to know that nothing about this work is clean and, oh, this is the pathway that it will take and this is the process that it will be. It is hard and it is complicated work. And so their perspectives about what did and didn't work and what they thought it would be, I thought is valuable for you guys to read and to know about and to be able to learn from. Are any of you doing work specifically in food sovereignty right now in your respective communities? Washington, what state are you from? Washington as well, great. A little bit in New Mexico, yeah, New Mexico's been doing great stuff with this. So this concept of food sovereignty is really, really important to our indigenous communities that we're working with, because traditionally, even within the dietary guidelines, we define things within this certain way. And what this allows us to be able to do is to be able to go in and listen and talk to the communities and let them define what this looks like for them. And oftentimes with the communities that we've worked with in Arizona, it's just them going back to their traditional foods and their way of growing. Peppery beans, for example, is a traditional food that was native to Arizona that had started to go away, that many local groups in Arizona are making a really concerted effort to try to bring back and connect their families back with those sources of foods. And how this manifests itself in a system approach is not only having, maybe a policy in place that says this is what food sovereignty looks like for this community, but then this is how we'll implement it through our different systems. So this is what it would look like in the local school. And this is how we honor it in the local grocery store. And so there's lots of different environments and avenues in which you can kind of push that through. Again, completely fueled and community driven, and just you being a support to help them along that pathway and what that means. This is not new. This has been around for a long time and for many years, and First Nations has done a ton of amazing work around this. So I would say if you're interested in this, First Nations is a great starting place for resources and tools of what this looks like. The most important piece, though, is nurturing those relationships of those you seek to potentially do this work with. So there's that one perspective from Navajo Nation, but then the other perspective that I want to share too is this rural perspective. So a lot of the PSE work that we think about and that we do traditionally has been rooted of what would work in urban environments. So for our maternal child health populations in Arizona that we were working with, we were working in early childhood, and we knew that there was a lot with that those moms were saying they wanted with respect to community design. They wanted more parks for their kiddos. They wanted more sidewalks and all of those things. And then when we took those same concepts from a Phoenix environment and we took them out into the rural environments in Arizona, and we started talking to them about sidewalks and these different things, they just looked at us with like blank stares. We're like, that's the least of our worries right now. And so you start to learn, oh, this is not, a one-size-fits-all approach. And so it's the moment to stop and pause and say, let's talk. Let me listen more to you and tell me what is it that you need. And we found in Arizona that much of our rural work on the active living side, they're very interested in trails. They definitely are interested in parks, but talking to them about complete streets, if you're familiar with those types of concepts and those types of things, is totally off their radar and doesn't necessarily resonate. On the food side of things, when you talk about, low food access areas and, proximity to grocery stores, where in an urban environment, 1 to 2 miles, that's a bit much. They might then be in what, have been called a food desert, even though we in Arizona don't like that term food desert, because we see the desert as a beautiful place and that has a negative connotation. But in rural environments, they might think that it's no big deal to live 10 to 20 miles away from a grocery store. So to us as researchers, we might see that as a problem. But when you go out and you start talking to the community, they're like, we're fine with it. Just, we don't need a grocery store in here, but we would love a farmer's market. How do we get the farmer's market to come into our community? So that's what this kind of unique tailoring of, it's not about trying to help you get a grocery store. It is, just let's start with a farm stand and go from there. The other important piece is knowing your audience. So what, Congress might believe in and what they perceive to be the problem and the issue and how you frame the issue when you're even having conversations with your Congress people is going to be very different than just the community members in that rural environment as well too. So your message for the issue that you're working on is going to be very different based on who you're talking to. And what's really important though is to elevate that rural voice or that tribal voice or whatever that might be and help take their story. Sometimes they can't be the ones to even go to the state capitol, let alone Washington, D.C. So how do you take that story and do it justice and carry it and share it with the Congress people that you're working with as well too, so that they understand the true need too. So I know many of you are in government roles and different programs that might have limited capacity with what you can do with respect to advocacy and policy work, let alone can't do any lobbying at all as well too. And so one of the best ways to get started, I think, is to join coalitions and collaborations. And so I think it's really powerful that you're going to be spending day 2, your next day tomorrow, focusing on building coalitions and collaborations and working with partners. One of the best ways that we found to be able to do that in Arizona is we have lots of different coalitions. So get to know which coalitions exist in your state. For example, one of them is the Arizona Rural Development Council, who puts on rural policy forums. And that's how you can get out and connect with folks that are working in other rural communities like you to understand what the need is, but you can still stay in that education role if you are working in government or in government programs. Another piece of the homework was I asked you to identify if you have a statewide food policy council. Food policy councils are powerful coalitions of lots of different partners, many of which work in government roles, but you have the power of other folks behind you that might have the capacity to do the lobbying side. They might represent the lived experiences, individuals that are participating in SNAP and WIC themselves, as well as the government programs. And so that's the power of coalitions, is understanding how when you're all working together, you can all share your strengths and achieve a much greater impact in that way. So I share that as an example. So what I want to focus on for this last part of the presentation is just some tangible real-life things that have happened recently in Arizona that I can just share with you, the good and the bad, because you do things like, oh, I put my foot in my mouth on that one. I shouldn't have said that, or we thought it was going to be this, but it ended up being that. So I want to share that with you to know that there's a way to overcome that perception or that wall that you might hit of PSC work is hard and I don't even know where to start. So this is the first one. So at Pinnacle Prevention, we're the implementing agency for FINI, which was mentioned in the previous presentation under Farm Bill. That stands for the Food Insecurity Nutrition Incentive, otherwise known as Double Up Food Bucks. We implement that statewide program in Arizona. Under FINI, you do need to have a match to be able to do this program. And unlike California, who does have a great, robust statewide investment in their food system, Arizona has $0 invested in our local food system. So we recognized through this work, and when we were trying to do this match piece, that we couldn't leverage any state funding, that we had to go out to different foundation partners. And those foundation partners were starting to tell us, hey, the state needs to put some skin in the game here. We want to see something happen around this. And so with that came what we call Let's Grow Arizona, which is our statewide campaign to get statewide appropriations to support a SNAP fruit and vegetable incentive match in Arizona. So we introduced that last session, and it passed. And just to give you a perspective of why the federal, state, and local policy work matters, is that because, as I mentioned, this stemmed from the Farm Bill, you had to have an understanding of the Farm Bill and where it fit into the Farm Bill and the impetus behind it and the intent to be able to frame that message, which was important. Then we had our state bill, and we had to understand the context of what our state was up against at the time when we were pushing this legislation. We had a severe education funding crisis, and we still do in Arizona. So at the same time that we were doing this bill, we had 75,000 educators go on strike and descend upon the Capitol and say, we need more state funding. Keep in mind, this is an appropriations bill. So there's that perception of you're up against this, and are you going to take money from education for this? So it's so much more than just food and nutrition and just convincing folks that this is a good idea because of the health of it, but really helping people understand against all of these other competing factors, how does this feed into all of that? And then in that, the way that we leveraged our messaging is that we did work through our statewide food policy council, which is Arizona Food System Network. We convened and connected with our tribal partners as well to make sure that they had a voice at the table as what does this look like in their community, and then especially influence the rural farmers. So if you're familiar with Arizona, we are and even at the time we were a trifecta where our governor's office, our House, and our Senate were all GOP controlled. And so there's some interesting values and thoughts and perceptions around SNAP and anything that has to do with SNAP. And so why this journey map becomes so critically important is because as we were going in to have these conversations with our state legislators, there's a story I was telling myself in my head that was their values around this and what I was going to have to do to convince them to see the other side of the picture. And what we learned in those conversations is their values were very much in support of rural farmers, and they really could get behind this when they understood the impact that it had on rural farmers. They had some thoughts and some perceptions about SNAP that were incorrect that we were able to correct and fix, like, no, you can't buy cigarettes and alcohol with your SNAP benefits. And it was nice to be able to share and be like, oh, actually, yeah, many people might think that. Let me tell you, it's a little bit different. So all of those pieces come into play when my own journey map and values came out. The legislators I'm talking to, their values start to come out as well. And then you find that magic messaging and that dance of what resonates and what works. And the rural farmer piece of it is what really ended up working. Another piece that we tied in is this is Congressman O'Halloran, who in Arizona, he sat on the House Ag Committee, so he was really important. So there was things that were happening simultaneously. Is that first we wanted to influence him into ensuring that Finney stayed a critical component under the Farm Bill when they were under negotiations at the time, and that he was fighting for that, and he understood what that looked like in Arizona. And at the same time, with his local state connections, that he was also reinforcing to our state legislators why this was important and what this meant as well, too. So to do that, we took him out for a farmer's market site visit and farm tours. And what was beautiful about this is that he got to see FMMP benefits being issued at the farmer's market, WIC benefits being issued at the farmer's market at that time, plus the double up benefits, and got to see all the programs in action and the moms with their kids who during the heat would come and stand in line with their kids that were so excited to get their farmer's market nutrition benefits and what it meant to them, and was able to have conversations with them. And so our government programs and partners were just there doing their roles, but were able to talk to him when he would ask questions asking about it. So having him there on scene was really important. I am also fortunate that on the right there, that's my beautiful, amazing daughter. And so you know that in public health that you end up exploiting your children for public health purposes. So she was able to come down and join me on this adventure too, and I'll talk more about that at the end and what that means with our journey as well too. And so this was also the opportunity to connect him with local farmers. And there on the right, you'll also see his wife. So through me trying to understand his journey and his map, I started talking to her a little bit more. And of course, we know that the partners of our congresspeople are oftentimes big influencers in their work. She used to be a child care teacher and a preschool teacher. And so I saw her face just lit up when she was seeing all the mamas with their kids out there at the market. So I started asking questions, and that was really, really powerful. And she had no idea that these benefits and services were available to moms on WIC, and what that meant and what that connection opportunity meant. So don't underestimate the power of the extended family and partners and what that plays in it as well too. And she especially connected with one of our local farmers here as well, who farms out of Queen Creek in Arizona, if you're familiar with that area, and wanted to know his story. And even as we were rushing Congressman O'Halloran along, she would stay and she would connect and she would listen and talk to the farmers to hear their stories, to really understand what was going on. And then we took him to one of our urban farms as well too. And so in Arizona, we're typically known for our 4 C's, which is copper, cotton, citrus, and cattle. And those things other than copper, tend to dominate the Farm Bill discussion. And so the big players that had Congressman O'Halloran's ear were our cotton growers, and they have a huge impact on the Farm Bill. But we wanted to ensure that our small urban farmers and these tiny but mighty programs were able to share their story with him as well too. So we took him out there, and he got to connect with some of our farmers that are farming down in South Phoenix, who share their story about how they're bringing in new young farmers, reducing rates of recidivism in that area, and helping to connect the community back to local food traditions and the local food practices in the area as well too. So again, hopefully you're starting to see this theme with storytelling as we went along. So it wasn't any sales pitch. It wasn't a lot of convincing. It was taking him out and letting people tell their stories of the work. And then finally, that's one of our farmers. They're testifying and speaking in a committee hearing. We had some farmers market managers, some health sector partners that came down and also spoke in committee as well. And of course, the end of the story with that bill was that it did pass and that we did get our appropriations for our fruit and vegetable incentive match in Arizona, which is the first food system investment of its kind in Arizona. And at the beginning, I can't tell you how many people said this can't be done, especially in Arizona. And when we put away the stories that we were telling ourselves of why it can't be done and just went in there and just tried it, it was amazing what we were able to accomplish. So again, I want to reiterate, though, I hope you're not discounting this work because you're thinking, I can't play a role in this because I work within government or within a government program. Our critical partners that helped to make this happen were our SNAP Ed partners that worked in state government, county government, U of A Extension, and then also some of our nonprofit partners that didn't have the ability to do lobbying because of their own bylaws like we did. And they all played a role mostly in that education piece to share stories of the customers that they served and what this looked like and what these programs meant to them. So every single partner played a role regardless of if they were in a government role or not, or whether or not they had the ability to do advocacy and lobbying. And then finally, just to keep us on track here, I want to tell you a little bit about the small town of Globe, Arizona, which Jose here at the table, when he interned with us, wave your hand, Jose, so everybody sees you. When Jose interned with us, he got the fortunate experience to learn a little bit about Globe and the Gila County community. And that's what happens when you do intern with us. We say, come on, you're going out to rural Arizona and you never know what you're going to get. But this community was built on mining. It's a mining town that over the years has seen a lot of economic distress. So when the mines are doing well, the community is doing well. And when the mines are doing bad, the community is really doing poorly as well, too. So the population up there is about 7,300. The town that it's right next to is the town of Miami. So we do have a Miami, Arizona as well. So all combined within the region, you're looking at about 10,000 people in this region. We have been doing extensive work in this community for many years, mostly within our SNAP Ed role. And we started to hear repeated themes of some of the things that the community wanted. On the food system side, it was more farmers markets and increased access to farmers. And then on the active living side of things, they desperately wanted an aquatics facility and a pool. And we asked them time and time again, what does this look like? What do you want? That's what they wanted. Go figure in Arizona that they would want a pool. And when you're down in the urban environment, you will see pools everywhere in the Phoenix, Tucson communities. In the rural communities, they are very, very expensive to maintain a pool. Not only to put it in, but the maintenance and the operation piece is really hard. So they had a pool. It went away. And the people that wanted the pool the most were the moms of young kids and our seniors who wanted to be able to do some water aerobics in the pool. So through that work, what we started to identify was what were the barriers that were preventing them from getting there. And typically what comes up the most frequently is funding. And you heard in the earlier presentation too that much of the advocacy piece is just advocating for proper funding and infrastructure support. when we talk about, why the schools might not be able to meet the nutrition criteria that we're giving to them, is because they're working on very, very, very limited funding. And that is a true and real barrier that stops progress from happening. And so all of these pieces is what came together, and we started to realize, okay, we heard in the community health assessment they really wanted a pool. This continued to get reiterated in community conversations and focus groups. The hospital there is willing to invest in a pool amongst other partners, the mining partners, et cetera. There's some city and town general funds, but truly the maintenance and operations piece of it is what was the barrier that was stopping that from happening. When you are in rural environments, much of the tax base is based off of population. And when the population is not large enough to support that, that's when you run up to barriers and challenges. So the burden that had been in the past was that just either the city of Globe would have to fund this through their tax base or the city of Miami, but having to do it with just one small town was not going to achieve what they needed to achieve. And so they recognized they needed to create a regional district to be able to pool their tax funds. And so that then is what has popped up a bill that we have in this session. And you'll see our bill tagline for this session is Pull Together Arizona. So the last one was Let's Grow Arizona. This one's Pull Together Arizona. I can't tell you how important these little taglines and marketing piece are in trying to push through policy. And what it is actually is that it allows the creation of a special tax district, which is an aquatics district, that the community can vote on through a ballot initiative and say, yes, we want this tax district to be created, and a portion of our taxes will go towards supporting this aquatics facility. So that all seems very complicated, and I know I'm getting into the weeds in that, but that's to say that you can't just wear your nutrition hat in this work. You have to be able to speak economics. I think, Patty, your background in banking, I never knew you had that background, but I'm sure that's incredibly powerful when you have to talk about the ROI of the work that you're doing, those different pieces. I can't say highly enough how much you have to get into the nitty gritty of tax and investment and all of those different pieces, because ultimately it comes down to how much is this going to cost? Does this have to be a cost neutral solution? What does this look like? So I share this one with you as an example of having to know that piece and know that, yes, my personal motivation for this is that I want this community to have a pool so that they can be active together. But for them to be able to get there, we have to start talking taxes, and we have to go that route. And I don't think it's very fun, but I know it's the barrier that they have to overcome to be able to get them to that point. But I can't go in and preach to the community, you need parks, you need pools, you need sidewalks, you need all of these things if there's this huge barrier that's preventing them from getting there. So this one actually, surprisingly, has passed. Taxes are a no-no when it comes to certain legislative groups. And this one has passed unanimously as well, too, out of the Finance Committee. It's in this session right now. And the reasoning for that is because we had these amazing women down here at the bottom from the community come in and tell their story. So it wasn't me. They came in and told their story about why this is important, what it means to the local swim team, what it means to the seniors. They've been living here in the community the longest. They could tell the story much better than I did. So it was them coming in to share and tell that story. And so when we think about what does really that true equity piece of this look like in the PSE work when it comes to working with tribal populations and rural populations and different groups who are unlike yourself, it's letting them have the voice and be part of the design of the discussion, and just listening to them say, this is what we want, this is what it could look like, and then you help them brainstorm together about what it could be. So this is what it looks like in rural communities. So in this top picture here, this is actually in Globe, where we're all looking at a map together and we're talking about trails. And what does a connected trails network look like for families, and how do we get the moms who maybe have strollers and different things out there using the trails as well too. It looks like having these women travel all the way down to the state capitol from their rural community to say, this is really important for us, and this is why we want you to listen, and this is what it means for our community. And then finally, it's this one too, and this is Sterling up here in this right-hand corner. He's from Tohono O'odham, which is a tribe which is in the southern part of Arizona. And this is another bill that we have in session this session. And we actually We're inspired to do this bill from Ajo Center for Sustainable Agriculture, which is a local-based coalition that saw that Colorado passed a bill for farmer apprenticeship. And we know that one of the biggest barriers that's stopping our farmers markets from being able to grow and our farm to school efforts from being able to grow is not having enough young farmers entering into the field. And so taking that legislation from Colorado and adapting it a bit to make it more specific from Arizona and saying, hey, we want to do this, we were able to bring this bill to our state legislature this session, which is the Farmer Apprenticeship Bill. And the most important piece to this one, too, which also passed unanimously out of its Water and Ag Committee, was, and this is another appropriation, surprisingly, so when people say, oh, Arizona won't fund that, yes, they will. You just have to tell the right story. Was having the community themselves and having Sterling and those from Ajo come in and speak and say, this is why this is important for us. And what was interesting is that some of the legislators on the committee were speaking about what Tohono O'odham needed, and then you had Sterling that was able to come up and say, I'm of the community, and this is actually what we need, and this is why this is important to us. And I think that was humbling for everybody. And that's another picture of them down there with Senator Otondo, who sponsored the bill. So this type of work can be scary, and we might tell ourselves a story in our head of why they'll say no, or what they believe, or what their values are. And so in summary to this, the reason why I share this is because you can't make progress on the work unless you go in and start having the conversations. And you will fail, definitely sometimes pushing through policy, but then you start to hear from them what their messaging is or what their reasoning is to support something or not to support something. And it gives you an idea of how to reframe it the next time around that will make it that much more impactful. So then lastly here, before I go into questions, this is my son now. So I exploited my daughter with Congressman O'Halloran, and this is my son now who, gets voluntold that he's going to go speak in committee. And this was, I don't remember if it was last session or the previous one, where we were trying to get recesses back in school. And unfortunately, we had to mandate recesses because so many of our schools were not doing it. So he went there to speak about why recess is important. So use your loved ones as need be as well, too. And so the biggest impact that I can say is to understand your role and what you have the ability to do, whether it is, actively advocating for something or just serving in that education piece. And both are important and powerful, and we would not have been successful with any of these efforts if we didn't have the local program people also providing the education and sharing their stories of the clients that they served. The message has to be so spot on. I can't reiterate that elevator speech enough. As academics, we might love our data. They don't always love the data, and if you go in with 10 pages of data, it's just going to go right in the trash. Like, you have to get it down on one page and you have to make it succinct. So pick the right data. And there's some folks, public officials that love the data, and there's some that no matter what will not believe the data because, they've seen their neighbors and this is what they believe is the story out there. So you just have to listen and figure out how to reframe around that. And then most importantly is the community voice. So making sure that you're first doing no harm and that they are at the table and sharing with the legislators and trying to do whatever you can to help them overcome those hurdles to get them there, which is, yes, they're not always going to make it to DC and they're not always going to make it to the state capitol. So what can you do? Is it coordinate a phone call? Is it coordinating a site visit out there in their community? What does that look like to make sure that the community's voice is heard? And then the commitment to see it through for the long haul. This is not some short, quick, easy, it's done. And then also, once you pass the policy, the implementation piece becomes even more important. We don't want it to just be good policy on paper, but what does this look like and translate it down into the communities, which sometimes that's where we've had the biggest hurdles, where things get implemented the wrong way. And you have to go back and revisit it. But just know that this is something that you continually revisit and redo, just like we do with our rules and our regulations when we change things in our public health programs that have been around for a very long time. So that's that piece, and I wanted to open it up to you guys to ask me questions now about the work or what this means or where you see yourselves fitting in, especially in respect to your own journeys that you've done here.
Thank you, Adrienne. That was wonderful. So what I learned from your examples was to have patience and a lot of perseverance. I was wondering if you could provide sort of a time context for how long it took for you to do the double up bucks and what was sort of the time period? Had it been introduced before? Had it failed? Was this the first time and you just had a lot of good success?
Yeah.
Can you provide sort of how long it took to get to that end point?
Yeah, great question. So the question was how long for double up food bucks for that bill, the kind of the time process from point A to point B. And I can even say just applying for the Finney grant, we applied in 2015, we didn't get it. We applied in 2016, we got it. We'd been implementing double up food bucks for a year and a half. And then we knew right away from the point of implementation that we wanted to pursue the state legislation. So we started working with the stakeholders and grassroots partners very early on from the beginning to say, is this something that you want? What would this look like? How much funding is needed? Which of course we didn't get anywhere near the funding that we needed, but it was a start. But we actually passed it the first time we ran it through the session, which was super surprising. And I can only say again, I think it's because we had the farmers and the stakeholders there at the table advocating so loudly, and we had an amazing bill sponsor who was a huge champion for it as well too. Yeah, thank you. Great question.
I promise you'll get lunch. I won't make you each ask a question.
This was so great. Thank you.
Yeah.
I think a lot of this, because we do a lot of work, of course, in tribal communities too, and this can be really challenging when we're applying for grants. It's also important for us to communicate this. There's a time difference in this work, particularly with tribal communities, that's important for us to communicate to funders and to really make the case for, okay, you might be used to this taking 2 years in this urban community and wherever, but it's probably going to take us 4. And building that in is just really important, because the relationship development process, if you don't already have that in place, which is why those of us that do work on those relationships protect them so carefully, because we know from Prevention Research Center in New Mexico, I mean, I've only been there for 10 years. It's been decades of building that trust in tribal communities and rural communities. And so this is another thing to think about, I think, also for trainees, as you're going into this work. Like we get these random calls from people who are like, oh, I'd love to come work in your communities and do blah, 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 blah. And like, okay, slow down. What is it that you want to do? What's your really making sure that, so in some ways we're also, even as non-native researchers, we're also the gatekeepers for those relationships too, and really protecting those. So that's something also to keep in mind, like if you do reach out to a research center or a research group or a nonprofit who's doing this work, if they're slightly hesitant to bring you in, it's not about you, right? And it's not that you're not worthy or any of that. It's just that recognize that those relationships are so critical.
Absolutely. Well, no, we get asked all the time from funders when we're doing work in their community, and they would say, go out and focus group with the tribal communities. And then I just say, to what end? Like, what are you going to do with that information when you get it back? And if we're not invited in, we're not going to do it. And then if we give you that information, you better plan to do something with that. If you don't, we're not going to do it. And I'm not afraid to push back on funders and say that. And I would encourage all of you to do the same, but always to what end? How is this going to be used? Yeah.
So I was curious, I was thinking about how, first of all, I loved hearing these stories. Thank you so much. And I feel like we don't get to do enough storytelling. And luckily, I get to work with tribes as well, and I have the privilege of getting to know people and share stories. The people who went and testified on the bills or did some of like the door-to-door stuff, were you guys able to support them either with their travel or stay and things like that? And then also, could you speak, especially to some of maybe the trainees in the room, how you were able to leverage the, I guess, government aspect, and then being able to get the community to do the things they do by being able to support them either financially or other things like that?
Yes, great question. I love that. So at Pinnacle Prevention, we believe passionately. Oh, yeah. So just to repeat, the question is, she asked, were we able to support, whether financially or through incentives, some of the community members that came in and did the work and helped to support it. And we believe passionately that, we get paid to be at the table, so the community better get paid to be at the table. And they always say, bring community in. You got to pay them for their time. Or especially with moms, we get some babysitting or encourage them to bring their kids with them, or whatever that looks like, is really important. So on the SNAP side of things, we've worked with promotoras in our community, and we did pay them. We paid them cash directly, a certain amount. Some of them may or may not have different work status limitations, to put that in that way. And so you are allowed to pay people out a certain amount before it has to be reported to the IRS. So we just made sure we stayed under that threshold, and we were able to pay them out that way for that. And then on the other side of things, in grant funding efforts, we build in the travel stipends and those types of things, and those honorariums into the grant efforts as well, when we know that people need to travel in to speak, or whatever that might look like. And it's been really successful building that into the grants that we write for. So I definitely encourage you guys to consider building that out into the grants as well too. Yeah, absolutely. Yeah. So she asked if we also provide technical assistance to them. And so much of that is helping them. It can be very nerve-wracking if you've never gone in to speak to committee or done these different things. We help them develop their talking points, but not speak for them, like listen to their story and then help them condense them. And the technical assistance includes letting them know what to expect. When you go in, you're going to say, Madam Chair, and there's a formality to this process, and how you address, and you get 1 to 2 minutes to speak, and they're going to limit you to that, and then they're going to cut you off, and all of those things, so that they understand. That's a critical piece to all of that. But then when we invite public officials out to their sites and their community, that's kind of their turf and their area, and we give them and honor them the flexibility to be able to share their story as they see that they need to when it's out in their own community. Yeah, great question. Can you repeat it?
Okay, I can just, oh, there we go. Sorry, I wasn't close enough. I love that you talked about farmers, one, bringing the legislator to the farmers, and then also having the farmers testify or talk in hearings. I'm hoping maybe you can talk a little bit about how to work with farmers, since small farmers and mid-sized farmers don't have a lot of workers, and they work very hard. So maybe just for those interested in engaging with farmers, talking about harvest seasons and when is a good time to make an ask and when is not a good time, because this kind of builds off the, did you pay for people's travel? Did you compensate them? How to help them? And I think just recognizing also farm workers and farmers' time.
Yeah, so critical and important. So asking a so the question was recognizing young farmers, especially small farmers' time and effort, if you want to invite them into this process. Asking farmers to leave the land is a huge ask. So you don't do it unless there is, a very thoughtful and very specific approach to that. When we invited farmers in to speak in committee, we were mindful of those that were close enough nearby that had the capacity, that also maybe worked in collaboratives or co-ops, or had interns or food corps members that could kind of help manage the farm and the land while they came to be able to do this. But it's not realistic for them to be able to do this all the time. You have to have a good cohort of farmers to be able to pick from. So when one is not available, you have another that you can pull in. but don't try to get them all down there, but elevate their voice then through, like we use Phone to Action is this amazing policy platform that we use where they can text in and message in and send their messages, very similar to what was shared that A&D uses for their policy work. That's a way to get them to engage in a more mobile advocacy type way when they can't be there in person, which they have all appreciated and is really powerful, especially when you're in big states and it's hard to travel to places. Is there another question? Okay. Well, thank you everybody for allowing me to share. Good luck in this work. It's so critical and important. I love that you guys are having this conversation here. I do have to leave right after this session, but if there's questions that you have for me, you have my contact information up on the screen. Don't hesitate to email me and to reach out and continue your great work. So thank you.
All right.